Hello and thank you for joining me. Welcome back to the channel. My name is Margaret Martin. Today I'm going to share a surprising fact about osteopenia that might change how you think about your bone health. But before I reveal this crucial information, let's talk about what osteopenia actually is and how it's diagnosed. The gold standard for diagnosing osteopenia is a bone mineral density test using a machine called a densitometer, commonly known as a DEXA or a DEXA scan. These tests became available in 1987 and have been our main tool for assessing bone health ever since. So when you get your results, and hopefully you do, you'll see your bone density measured in grams per centimeter squared. But what doctors focus on is another column, referred to as your T-score. This score compares your bone density to that of a healthy 30-year-old woman. Since 1994, here's how we categorize these scores. A normal T-score is anything above -1. Osteopenia is a T-score between -1 and -2.5, whereas osteoporosis is anything in the T-score range below -2.5. There's also a newer assessment called an Echolite REMS that similarly provides T-scores for your spine and your hip. A 2024 paper titled Osteopenia, a Target for Fracture Prevention, highlights that the importance of osteopenia label for diagnosis and treatment is often unclear and misinterpreted. Many individuals with bone density scores in the osteopenia range are simply told, all is good, without being informed about this crucial fact. Now, here's the surprising fact that your doctor may not tell you. Most fractures occur in people who have osteopenia, not osteoporosis. One of the reasons for this is that there are so many more of you with osteopenia. But there's also your bone quality to consider. So most of us never think about our bones until we break one. We assume they'll be there as our foundation to support us for life. But here's what's important to understand. A bone density test tells you just that, the density of your bones. What about the quality of your bones? It's actually the combination of bone density and bone quality that determines how strong your bones are and therefore your risk of fracture. So this is where there's another tool called a FRAX calculation or a FRAX calculator that comes in. This should always accompany any bone mineral density tests. So somebody has osteopenia in that range, it will provide insight into bone quality as an overall fracture risk. It requires you to answer several questions. It puts in the bone mineral density of your hip and it calculates your FRAX. Now, for factors you cannot control, let's talk about those first. There's genetics, especially if you have a parent with a hip fracture. Previous fractures, particularly fractures of the bone that breaks from a slip or a fall from a sitting or standing position, we usually refer to those as fragility fractures. Then other questions in the FRAX will include eating disorders, nutrient deficiencies, and they don't ask this question, but whether or not you started menopause before the age of 50 or had significant periods of amenorrhea. These are all things that will affect your bone quality. There are many factors that influence your risk of breaking bone. We talked about the ones you can't control, but let's look at the ones that you can control. The first one being diet, getting enough protein, calcium through a diet rich also in vegetables and fruits, adequate vitamin D and other essential minerals. Quitting smoking, and your bones will thank you. Moderating alcohol intake, controlling your blood sugar, regular exercise, providing bones with the stimulation through strength training and weight-bearing activities. And shorter, more intense walks or runs actually stimulate bone strength better than longer, intense activities. So knowing what exercises to do that are best for your bones. So the diagnosis of osteopenia is not necessarily an indication for either intervention through pharmaceuticals. However, you should consider it an opportunity to make your bones as resilient as possible. Many of you can surely find ways to optimize at least one of the modifiable factors that we discussed. Many of my clients with osteoporosis wish that they knew that they had only osteopenia. They wish they were told that they had osteopenia, that during that time they could make changes. And by making them sooner, you can keep your bones out of the osteoporotic range. So don't wait until your doctor tells you, I'm sorry you have osteoporosis and that you need medication. You can start making changes for your bones and making them stronger today. I've created a playlist based on different activity levels to help you get started. This is where you're going to find it. Remember, never put off tomorrow what you can accomplish today, especially when it comes to your bone health. Stay strong, and I'll see you in the next video.